Our Best Bet project is on rheumatoid arthritis and therapeutic exercises, and this is by Anya, Sam, and Leah.
For our clinical scenario, we have Opal, who is a 52-year-old woman with a 4-year history of rheumatoid arthritis. She is self-employed as an accountant and contracts to 3 small companies in nearby cities. She was referred to an outpatient OT clinic due to exacerbation of her arthritis that resulted in increased pain, fatigue, and difficulty engaging in many important daily occupations. Opal has received a weekly OT session for the last 4 weeks, focusing on incorporating physical agent modalities and therapeutic exercises to improve her pain and stiffness. She started using Celebrex 2 weeks ago to help her manage her RA symptoms. She wants to discontinue OT services and only take Celebrex to help with her symptoms and to stop doing the therapeutic exercises. She has asked her OT if this is a good idea.
Our question states, for a 52-year-old woman with rheumatoid arthritis, currently on prescribed medication, are therapeutic exercises beneficial for reducing pain and improving hand functioning to engage in her job requirements?
Summary of Level 1 and 2. Studies indicated that therapeutic exercises for rheumatoid arthritis patients improved overall hand functioning, decreased pain, decreased disease activity, increased strength and musculature of hands, and improved quality of life and health status. All the studies included the patients doing the exercises within outpatient clinics and at home. Participants on prescribed medications found that therapeutic exercises helped to decrease pain and increase activity levels.
Summary of Level 4 evidence. This study indicated that stretching and strengthening exercises are effective in increasing range of motion on the hand and wrist joints for patients with RA. The patients were given 8 exercises and stretches to perform.
For the clinical bottom line, therapeutic exercises are effective and low-cost intervention for the management of RA symptoms, help improve hand functioning and mobility, decrease pain, and increase quality of life. Home exercise programs appear to be the most effective, and there may not be one perfect therapeutic exercise program that benefits all RA patients.
The evidence searched. We used the databases Cochrane, Nursing and Allied Health, Medline, CINAHL Complete, Taylor and Francis Group, and Health and Medical Collections.
Our inclusion criteria included adults over the age of 18 who have diagnosed RA, interventions involving therapeutic exercises, disease duration of at least 1 year or more, that the article was published within the past 10 years, and that it can be outside the scope of practice of occupational therapy.
Exclusion criteria includes articles not written in English, qualitative studies, dissertations, thesis, and non-published research.
The results of the search. We had 6 Level 1, 2 Level 2, and 1 Level 4, for a total of 9 articles.
Our critical appraisal of the evidence, beginning with Level 1 evidence. Our first study was a systematic review, and there was 8 studies in it, and it included hand exercises that had resistance and or active range of motion exercises, and their conclusion was that therapeutic hand exercises have a positive effect on strength in some aspects of daily living, and that they do not aggravate disease activity or pain when done correctly.
Another Level 1 evidence was a randomized control trial that looked at the effect of a 6-week-long isotonic and isometric hand exercise regimen on pain, hand functions, dexterity, hand grip strength, and quality of life. It concluded that isometric and isotonic hand exercises decrease pain and disease activity, improve hand functions, dexterity, and quality of life, and mildly increase muscle strength.
Another Level 1 is a randomized controlled trial. The duration of the study was 8 weeks. And the conclusion showed that health status increased in case groups and pain scores decreased in the case group.
Our next Level 1 evidence was a 12-month-long randomized control trial, which investigated the effectiveness of tailored hand exercise programs. The authors concluded that tailored hand exercise programs are a worthwhile, low-cost intervention to maximize the benefits of medication since they improve overall hand functioning.
Another Level 1 evidence was a 36-week accessor blind randomized control trial that evaluated the effectiveness of a brief, supervised education, self-management, and global upper extremity exercise training program, supplementing a home exercise regimen for people with rheumatoid arthritis. It concluded that the extra program improves upper extremity disability, function, hand grip strength, and self-efficacy. Another level 1 evidence was a 6-month randomized controlled trial that evaluated the effects of combined strength and endurance training on disease activity and functional ability. It concluded that a combination of strength and endurance training resulted in considerable improvements in muscle strength and cardiorespiratory endurance, accompanied by positive changes in body composition and functional ability.
For level 2 evidence, we had a 18-week-long case-controlled study which investigated the effectiveness of hand exercise programs, and they concluded that short-term hand exercises done at home can enhance hand function and can improve hand force after only 6 weeks into the program.
Another level 2 evidence is a 14-week clinical controlled trial. It looked at effects of intense hand exercise program and a conservative hand exercise program on hand strength, joint mobility, pain, and functional ability. It concluded that intensive exercise program decreased the pain level, was more effective than the conservative exercise program for hand strength. Level 4 evidence showed a 3-month single subject study. It looked at increasing range of motion and enhancing functional activities by using stretching and strengthening exercises. It concluded that stretching and strengthening exercises are effective in increasing range of motion of hand and wrist joints.
So our implications and reflections on our BestBET research. For occupational therapy practice, we found that OTs should be incorporating evidence-based practice in regards to therapeutic exercises when treating patients with RA. Therapeutic hand exercises appear to be one of the most low-cost and effective interventions that OTs can use. And additionally, therapeutic hand exercises increase a patient's quality of life and hand functioning for ADLs.
For education, occupational therapists using hand therapy should be certified and continue to engage in continuing education classes. Practitioners interested in becoming certified hand therapists can receive training and certification. Occupational therapy curriculum for master's and doctorate programs should have an emphasis placed on hand exercises to treat rheumatoid arthritis.
For future research, it is required for higher quality evidence to inform practitioners and clients about possible outcomes and the effectiveness of therapeutic exercise interventions. Level 1 research is necessary for results of effective exercise for RA, durations of exercise, effects of long-term versus short-term exercising, and the quality of the exercise. Other exercises beneficial for RA would be swimming, Tai Chi, gentle yoga, and many more. Exercise is not a one-size-fits-all treatment. And this concludes our best bet. Thank you for your time.